most instrumental.
Sorry.
He's been most instrumental in getting, it recognized as a science out here. And we are always thankful and grateful to him. And
Dr. Riyaz, you know what? When you said we have new doctors, I thought you want to tell me behave yourself. We have new doctors. We should be, really quiet, respectful. You've come. It's 4 a.m. over here. My time. So
lovely.
4 a.m.
down.
So for a couple of them have been my professors, and behave yourself. They know that wherever I was, I've never behaved myself. And I'm sure within them mind, they're still thinking, how come he actually ended up becoming a practitioner. But they're great doctors, mentors, and it's lovely to have them on, today with us.
Absolutely. Okay. So
you want to start?
We can yes, I think we can start now.
We'll all mute ourselves, please.
Yeah, please. I'll just mute all. So I'm audible enough?
Yes, we have to unmute.
Okay. Good morning, dear doctors. Once again, I welcome you all to our Zoom platform to celebrate World Mental Health Day. We have some of the distinguished professionals with us today who will share their experience and enlighten us with their knowledge. I welcome Dr. Santosh to take over the platform and talk about the importance and relevance of this day to us. Thank you. Dr. Santosh.
Yes. Thank you, Dr. Ritu. Good afternoon to all of my dear friends. Today, we are celebrating World Mental Health Day as our World Homeopathic Day. Actually, mental health is vital for the growth and productivity of each person and is important for a healthy and happy life. The homeopathic understanding of health is intimately connected to its understanding of the mind in general. We homeopaths believe that the body and mind are dynamically interconnected and that both directly influence each other. Our science depends on psyche. The psyche part is the basic thing for the majority of the diseases. There is a psyche, brain, body relationship. Triad is there. Whatever one feels, whatever one thinks, whatever one perceives will be reflected in a particular part of the brain which have connection to the particular part of the body. So the perception has to be changed so that the disease will go from the body. This is what Dr. Hanneman has explained in portion number 12. So in homeopathic system of medicine, psychological symptoms are the primary symptoms which has to be taken into consideration for the selection of medicines. Whenever the psyche has to be taken, previously we have to search a lot, but now with the pathological symptoms, we can understand the mind. So the importance of mental symptoms is very, very high in homeopathic system of medicine. That is why, like World Homeopathic Day, today we are celebrating World Mental Health Day. Today, to speak about this topic, we have distinguished speakers. And the moderator of this today's session is my friend Dr. Riyaz Badami, who has been practicing in Dubai for the last nearly 2013 he has been practicing, and he graduated from CMP Homeopathic Medical College. Most probably these professors are also from that college. So today it's my privilege to invite Dr. Riyaz Badami to moderate this session. Please, Dr. Riyaz Badami, the dais is yours. Thank you. Thank you very much.
Thank you, Dr. Santosh. And yes, it's definitely a privilege today to be able to introduce all the guest speakers. Mental Health Day, we have lovely speakers out here. I don't want to speak much about it. We have qualified, much higher qualified people doing that. But our first guest I'd like to introduce, he's an honorary physician at Sri Mumbai Devi Homeopathy Hospital. He's also head of department in CMP Homeopathic Medical College, the college from where I passed out. He is author of various books, papers, articles. He is examiner, moderator for undergraduate, postgraduate courses in Maharashtra University, different places, a leading homeopathic practitioner in Mumbai, and above all, a humble and very down-to-earth person, Dr. Prabhakar Devadiga. Sir, would love you to take over. Mike, sir, your mic has to.
Thank you, Riyaz, for that wonderful introduction. And I can see Dr. Jerajani's eyes growing bigger. Anyway, mental health, no, that's what we are going to speak. No, I had this privilege because what we read in our organon is something, and what we practice, there is something which has to be together. And the moment I passed in 1985, I had a privilege of combining with Dr. Rajiv Jerajani, who is one of the speakers. And he took me under his wings and we did a lot of work. We had a psychiatry OPD till he retired. So, and that I continued further. So we have a separate psychiatry OPD in our hospital. And during those days, we had a lot of work which we did for addiction. To an extent that our paper, I think, got the prize also. And that was one of the first of its kind in drug addiction. But today, what I want to talk about is, see, today, I would first of all thank all of you for inviting me and also congratulate you all for practicing in Middle East, which was very difficult initially to start practice there. And it really gives me pleasure to interact with you all. The question is, after so many years of this, and we are celebrating Mental Health Day, we need to introspect on what we can do. What we can do. We have been practicing, we all practice as Dr. Suresh rightly said, that everybody of us has to use that aphorism 211, take the mentals and prescribe on that. So therefore, we are definitely prescribing on mentals. And what are those diseases which are not considered as mental disease are also treated by us. And when we see in our own practices that the people feel better, not only at the level of body, but at the level of mind. So that mental health definitely we are giving. But are we involving ourselves in the mental health faculty of each country? Even in our country, we have. Now, like, we have two major institutes in our country. One is in Kottayam and second is in Palghar, which have got inpatient mental wards, separate wards. We also have, but we do not have it as separate ward. So now we need to have many research, many work. So I will be giving a small presentation about what we can do. So can I share the screen? I hope you all can see the screen.
Yes, doctor, we can see. But you have to make it full screen.
I will do that.
Yes, perfect. It's working fine.
So we need to find out what are the areas we could be of help and which could be easily done by all of us. I have written addiction as the first one because that is where I first started treating patients in a large quantity. We have seen thousands of patients, and Dr. Jerajani is there. And we then had our own center where we are doing de-addictions, and later on there was rehabilitation center. So we were involved for many, many years, still seeing patients. But today we have got so many other disorders which we can definitely help. Like we have learning disorders and scholastic backwardness, which are classified in DSM-5 PR under mental health. Now that's a big chunk. And we have got anxiety, which is a common phenomena, stress management, and school and college mental health. Now, why have I put this as the first ones, not schizophrenia, OCDs, etc., etc. Those are something which we can definitely treat. But these are the things which people need to be aware of, and we should be part of the health system of any country, including our own country. So the whole idea is that from this year onwards, we should make a push towards this particular thing. So let us see how we can go about doing that. So first, a little idea about addiction. Now, addictions, smoking, cigarette, and now hookah is taking over, which has got many chemicals, which supposedly is supposed to be harmless, but which is not so. One of my students, Dr. Rohan Baltake, is doing a great work in that. And one of the time when you get a chance, you should be speaking, because he's speaking on tobacco addiction and all over India. He's speaking, and he's done a great work, converted many smokers into non-smokers. Alcohol, of course, may not be so much in Middle East, or if it is there, it's not very much in view. And drugs, substance abuse, one, and recreational drugs. These things have to be taken care of, and which homeopathy has got a great scope. We have been doing this project. In the initial stages, we were not very sure. So Dr. Jerajani and myself, when we did this research, we had 3 groups of patients, where one was given only homeopathy, another was given homeopathy and allopathy, and one was given only allopathy. And we had a good result in terms of not only de-addiction, the withdrawals, but also the relapse, because we know that in addictions there is a lot of relapse which occurs. And the percentage was something like this, where with only pure allopathy, which was given those days, we are talking about those days, the percentage was 48.9%. For homeopathy and allopathy, it was 78.6%, and for only homeopathy, it was 75.2%. Now you could see that with homeopathy, when we are able to change the mindset of the person, that helps the person to not relapse. The relapse was much lesser when homeopathy was given. We also tried our hand in potentizing brown sugar, if he remembers that. Yeah, but then, as you know, it is a chemical which is not the same all the time, but it did have its own effect. The other addictions which we see and which is written in our organon is known as dissipation. That means which is helpful for your sensual pleasures. And those are porn, games, movie binge, which nowadays young people are involving themselves. And this also we can and we are able to treat very well, very well. Scholastic backwardness. When I'm not taking a lecture on what mental health, I have a reason. We'll come to that. When I'm trying to see that, we need to know our strengths. Scholastic backwardness, we have autism. In this field, quite a number of people have done a lot of work. The leading one being Dr. Praful Barwalia in his Pandan Institute. He has done a very meticulous and great work on autism. And we have been all following that to an extent that we, in my own clinic, we have got 2 autistic schools, special schools, which we are treating regularly. Our doctors go there and treat, and we have got good results in the progress, because we have to see different scores are there, which shows that the progress is good when the homeopathic medicine is given. Same thing about ADHD. We again have CAR score, which has to be seen, and mental retardation. Now, this is something little, what you can do in mental retardation is a question. We do have the scores show that there is a person self improvement, where the person is able to do his own work in a way. So we have seen patients of we have got trisomy 21, Mongolism. those patients are also doing well. I do not say that we have been able to cure them. That will be very wrong on anybody's part to say that. Some research was conducted by ML Dawle Institute, which showed that 8.32% school children are having LD, learning disorder. So that's a big chunk for any country. Then 12 to 13% having scholastic backwardness. And when these people were treated, the changes were there to see. It's an ongoing research. Now, I'm trying to say some research, some things which we can do, because if you know our strength, again, I keep on telling that if you know our strength, we can make people aware where our science can be helpful. Anxiety disorders, definitely generalized anxiety disorders, panic attacks, phobias, and the newer ones, Google-driven disease anxiety disorder, which is a very new one, but very common. You all must have been seeing that. And fear of being missing out, that's another one, which are, names are there, but they are diseases, if you see from a different angle, because people are unhappy about it. Stress management. We can help in stress management in industries, companies, institutes, and school and college mental health. I was asked once that to talk about stress management in interns of Homeopathic Medical College. And the first stress is the teacher. That's what I had to tell. Because if we are not able to make their environment very friendly, then the stress is the teacher himself. And that stress needs to be managed. So when we talk about school and college mental health, we are seeing the environment. It's so that, as Hahnemann has said, that homeopathy is not only a physician, but a naturalist. When a naturalist is, when he goes to a jungle, he doesn't only see for birds or tiger. He also sees the tree, the insects, the foliages, the things which are falling down, and understands why there is useful for each other. So that observation which homeopath has, I do not think, at least all the science people would be. There are some good human beings or doctors who are naturalists, but others are only focused on their own branches. So that is one of the things which we can be very, very helpful. And children specific. Now, this is another thing which I feel, these are the common things which we can definitely do. There are other diseases which we have treated, which I am not going to talk today. So temper tantrum, oppositional defiant disorder, conduct disorders. These are the diseases which we have plenty of remedies and all of us treat. What I am trying to tell you is nothing new. All of you all know. The question is what we can do about it. What is the next step? Otherwise it is like every year we also celebrate Gandhi Jayanti. On that day we don't drink alcohol. When there's a dry day, and I don't know whether we have on that day we don't have violence, because there should not be no violence, but then that is there. That's all we do. And if we are going to celebrate our mental health day the same way that every year mental health day we will have a program or something like that, that will definitely not. We need to meet next year having done something more, and that's what my aim of talking today is. So in old age, again, geriatric care, their mental health also needs to be there. Now in Middle East, there might be a little different philosophy. Old age home may not be there, I'm sure, because of the culture. And in Islamic religion, there is this old age home is not a concept, because most of them, they have got some rules which most of them follow religiously. That is one thing which I have found very, very good. So I do not really know what is the situation in Middle East, but this may not be a thing, but there are some issues with the elderly people which can be definitely worked out. Severe and difficult cases of PTSD, OCD, psychosis are altogether a different thing, which we definitely have. All these are what is our scope with homeopathy, which all of you know. What are the opportunities and difficulties? That's what I would like to today talk about. Where there are opportunities, there are going to be difficulties, and where there are difficulties, there are definite opportunities. This is what I believe, and we all should think like that. That The opportunities for treating is what I just now talked. The difficulties is that whether we will be taken into the mainstream. Two ways. One, whether the general public understands us, that whether we can do something for it. Second, whether the government or the administration will allow us to do it. Now, we need to formulate a plan to get this into the field. And this is what I feel is a path where we can do that. First of all is the awareness. Now, when we say awareness, most of the time we can write articles, we can put blogs, and we can also write articles on the newspaper. But today, when people write articles, one has to be very responsible because there has to be some data. And that data cannot be from one person. So a pooling of data of all the physicians who are here and other physicians who are not attending, but who are there in Middle East, if there is some, you have got some associations, we can pool the data and then get some record is what actually is happening. Now that pooling of data is that not only patients who have come with mental illness, but otherwise people will have some or the other problems which can be classified and which we can make data about what is the prevalence and how we are really helping. Now, if we pay attention to each of our patients and we keep it aside, by the end of the year, we should have good data. Helping each other, again, like associations should not be only for listening to lectures or seminars and meetings, but then we should be able to help each other, like referring patients to each other, which I have been seeing that it is quite less in our field, where most of us feel that we are very good and able to treat all the patients, which may not be so. So once we pool our data, we know that someone is good in some illnesses. Like we have some people who are doing well in some illnesses, I do refer them and they refer back to me when they have some difficult cases. Not that they cannot treat it, they do, but some difficult cases, some minor points which we learn. Like I have been treating a lot of cases of psychiatric illness. Apart from that, I was also treating a lot of cases of tuberculosis, especially multi-drug resistant tuberculosis. And many of the homeopaths now, as well as some of the allopaths, also refer the cases when they get stuck. No, that is one of the things which we do. Like if I get stuck in some skin disease, I do refer to my senior Dr. Eno Goel is one of them. So, and we get an idea that, okay, because finally once we have taken the case, we are stuck in one way. Why not take another opinion, which will help us to find? Publishing these findings, whatever the findings which we have in small scale, doesn't matter, publishing that. And the last one, corroborating with other branches of medicine definitely helps. No, as I told you, I've been very lucky to be associated with Dr. Jerajani and Dr. Menon and Dr. Sanjeev Khanna. These are some of the allopathic doctors who were there in the initial phases of my journey. They are still there. None of them have left us. So they are there, and corroborating with them, we learn and we interact, and that helps us. No, I will give an example. When a patient of gallstone, which I was treating, I wanted to treat, when I sent it to for sonography, the sonologist, Dr. Mahendra Panchal, who was there in our polyclinic, he came running. Why are you doing this? It's already known, already kiya hua hai, वापस क्यों करता है? Why are you doing it? I said, I need to see if it is improving. He said, no, it cannot improve. It cannot go. I said, do it for my sake at least once, because we are good friends. He did it. And then later on, when he found that it is improving, he started sending all the patients of gallstones to me. What I'm trying to say, that corroboration, because see, just being in another branch doesn't necessarily mean there is a enmity or there is a competition. Every physician from whichever branch is trying to find a cure for his patient. So therefore, once that is understood, people do refer cases, we do that. And then research publication. Research needs to be improved on our side, and continued medical education to talk about the same thing what we are doing. All this definitely will help all of us to help this. If we have time, I will share one small case where we talk about how our medicine helps. Just an interesting case. It was a case of, I'm just speaking, I'm not going to present it. I had a case of neurocysticercosis. Now this is a tinea saginata cell eggs which are there in the brain, and this patient had come with convulsions. when she came to the clinic, it was already diagnosed neurocysticercosis, and the treatment was not helping. She was getting convulsions. Taking the history, we got a lot of history in the mental sphere. Her parents were divorced. She was divorced. She had multiple affairs. And she had this feeling that I am not a good person. Her words were, I feel I'm a prostitute. Now, this is a very interesting word. I'm not liking myself. I do not have confidence in myself. I have a lot of affairs. Reason is because the moment I'm friendly with someone, I want that person to continuously talk to me, answer my WhatsApp. And if he doesn't, I get angry, I shout, and then we break up. But usually this happens in the workplace. Therefore, I need to, or the other person needs to change the job. So now job, house, family roots, everything is in a dishevel. The remedy which we gave was lac caninum, and the neurocysticercosis disappeared. Now she did not get convulsion. One fine day she started getting convulsions, and I was worried. It was by that time we had finished 6 months. I said, now what it could be? Got the MRI done again, and it was showing that the neurocysticercosis disappeared. And after that, now it is now 9 years hence, no convulsions. That is again confirming what we read in our organon. In chronic diseases, the aggravation occurs at the last. But that's some of the things which we learn every time when we see our patient, we learn that. So in chronic disease, the aggravation occurs at the last. And that's what I learned. The interesting part here in the mentals is that after that, she got back with her husband. Now that's an interesting phenomenon. I said, how did this happen? He said, I do not know what happened with your medicine. It had a calming effect on my... And I was in contact with my husband because I have a daughter, and we finally got together, and I am now settled down, and I am having a very happy life. Now you can see that lot of things which are there in the mind gets settled down when we are treating otherwise regularly. So I think I can wind up, because unless there is anything which we need to discuss, this is what I think we can do. So for celebrating our World Mental Health Day, if we can take home that we can do something more about awareness, we all can get together and work this out. If we can do this, we will be doing a great service to the humankind. Thank you. Thank you all.
Thank you, sir. Really nice insight, and was really nice to hear you after so many years, as I used to when I was in college. Thank you, sir, once again. If anybody wants to ask anything, any doubt, or else we'll invite the next speaker. As you used to say before, sir, when there's too much of silence, either everybody understood everything or nobody understood nothing.
Or nobody has understood. I think everybody has understood everything.
I think, yeah, let's give. Yes, Dr. Susan.
Hi, I would like to ask, thank you for that speech, Dr. Prabhakar Devadiga. It's interesting to note the last case study. I would like to ask whether this case study has been published anywhere.
No, not yet. I am in the process of publishing.
Yeah, because, like sometimes I get a very big backlash. I mean, it's like when I recommend my clients to take some homeopathic medicine, they ask for proof.
Okay.
So it is very good if you have something like that. We can just show them, say, look, and refer to these case studies, these research findings and things like that, which is, I think, mostly lacking in homeopathy medicine.
Yeah, about the gallstones I have published. This I am going to publish. I am in the process, so it should be published in this year, definitely by the end of this year or the beginning of the next year.
You can share those, like links or those resources. And it would
definitely.
Thank you.
So it's time to thank you, sir, once again. It's time to introduce our next speaker. She's a globally acclaimed psychologist with a license to practice in Dubai. Not all have it. That's why I like to mention that. She deals with adults and kids. She is also a business psychologist, also very experienced corporate wellness coach. She started her career with WHO Street Children Rehabilitation Project in Kerala. She runs her own mind wellness practice in Dubai. She is an author. She has 2 books, Listen Mom and Dad, I'm Your Teen Speaking, and Design Your Life to Build a Legacy. A 3rd book is on its way. She's done a PhD in women's health psychology. She's an hypnotherapist, yoga specialist, and a lot more. I don't want to take all of her time. Let me introduce to you Dr. Susan Koruthu. Doc, please take over.
Thank you, Dr. Riyaz, and also thank you, Dr. Alphonse, for introducing me to this group. Hello, everyone. I think doctor has asked me, especially when we are speaking, speak about after COVID, how things are different from before COVID situation. Also, I would touch how I connected with homeopathy. I've been practicing, and especially I have over 25 years of experience in the mental health area. And I have done my master's in, especially in the social work, in the deviant behaviors, delinquency, criminal behaviors, that means the antisocial personality disorder mainly. Then I have done a master's in organization, industrial counseling and behavior, then had MBA in strategic and leadership management, then of course the PhD. So when I was practicing, I used to get a lot of clients who are taking already medication from the psychiatrist, and especially for the borderline, bipolar, OCD, or maybe stress, anxiety disorders, panic attacks, and things like that. When they come to me, I normally am a specialist, and I take the life as a whole, and I'm a life psychologist. I would like to call me as one, because I work with, especially with teenagers and adults, to build their life in a best possible manner. So when they come to me, and to get them get out of the medicine, from the psychiatric medicine, you know that there are a lot of side effects. So what I do is slowly I put my therapeutic methodologies, everything I use, and then slowly I detach them, or maybe reduce the medication slowly. And then I just slowly integrate them into homeo. So when the psychiatric medicine is reduced and I don't want them to immediately detach, and then I take them into the homeo medication, and it worked very well. And especially I refer my, my clients to Dr. Alphonse. And there are other clients who come to me from homeopathic doctors and who say that, I'm taking this medication, so that therapeutic way I need to get help. So I have personally experienced homeopathy has got very, very much effective, and especially cyclothymia, EUPD, the emotional unstable personality disorder, and anxiety, stress, and especially ADHD and the hyperactivity. Those areas I've seen it is working, and together with therapy, definitely, I have seen it. That's my experience so far. And talking about our life, especially, we think that for mental wellness, the mental well-being, if we have every system working properly, like, I have money, I have a great job, I have a family, I have shelter, and I have a good physical health, I'm going to really do good. Unfortunately, that's not the case. To be effective in life, you need intelligence. And when you think about intelligence, like all the days we had the IQ system, which only helps you in academic. So you need academic brilliance just to learn things, and then you get it and you apply things in life. But you need to have other intelligence as well to lead the life, which is life intelligence, where you need to have performance intelligence, you need to have achievement intelligence, you need to have emotional intelligence, social intelligence, financial intelligence, emotional intelligence, and spiritual intelligence. If all these intelligence work together, then we can say that this person is really doing or living a very good life. If any area it is not working, if the intelligence is lacking, or you don't know how to use that intelligence in those places and bring a result, then you will be suffering some deficiencies in that area. Fortunately, now the schools asked me to give, like sessions on emotional intelligence, also in the performance and achievement intelligence, which is slowly the schools are recognizing, and they are asking us to really provide them, which is a very good thing. When you think about what happened before COVID and after COVID, I'm a very positively thinking psychologist. I'm mostly focused on positivity of life. I can say that existential psychology has got a more of, kind of a role to play. That means, why do I exist? What is the meaning of my existence? And after COVID, many people, got affected by existential crisis. That means, I don't think, like I can make it happen. My life is not, kind of coming to an end. There are a lot of problems. I may not be come out of it. There is no use of doing all these things. At the end, what I will be going to do? Okay, what is the point in doing all these things? Like after that, I will die. Or, like, let me just finish my life. I can't take all these pressures. All those kind of things are happening, I could see. And if one good thing has happened is that people are more aware of mental well-being after the COVID situation. Also, they have identified as we are a social being where we need support of others. Like we need to be connected with people. Many families started to have better connection with their own other family members, and they have back in India or in their home country, they started to have more connection. And here also people started to have more connections that has been extended to various areas. Now, when we look at things in the family itself, the COVID has created a very good phenomenon. I'll tell you how I have seen this in my practice. When I get clients, kids started to stay at home. Parents started to stay at home. They could understand what the dynamics they are having, and there are a lot of problems started to happen in families because they spend time with each other and they could understand their tolerance level and what is their emotional intelligence, how far they can, accommodate the other person, their interpersonal dynamics. Everything become so evident in the house. And most of the time they say, somehow we want the school to start, and they start to go. Especially most of the parents are not able to manage the ADHD students, and they just wanted them to go back to the school. And another area, I would say, the husband and wife dynamics, because the office, they were away, they were most of the time away from each other. And when they become most of the time in the family fights and conflicts started to increase, and the home become not that nice place, because evenings only a few hours they used to see, and that also they are both busy in their own areas. But here what happens is that they are seeing each other in more. And some families, it's become really good. They started to work on the relationships and get better, and some families it's become worse, they couldn't tolerate. And especially the families where I work with personality disorders, and especially I'm a victim and survivor therapist of narcissistic personality disorder. If you look at my work on that, I work on mostly on NPD, narcissistic personality disorders. And these areas, people started to realize there is a problem in living with these people. And I can say that my client base has increased after COVID around 125% when I look at it. So that's the increase I have after COVID in my client base. I have every time clients are increasing because they started to look at their mental health more, kind of closely and effectively than before, because they are seeing it is very, very essential to seek help and build it. And I would say, okay, I don't want to talk about more into my area. I'm just giving you an example how it happened. And after COVID, even international level, I can see that the world become, kind of coming so closer. Now, I have clients in all over the world. I have clients from England, Australia, US, UK, even Maldives and Indian, most of the cities. So why I'm having, because it's all online. It's through digital medium. We can have the communication, we can have the therapy, because it's mostly into the talk and skill-based therapies. In the therapy, we have 100% results. And where I'm focusing now on how we can integrate, like how we both, the homeopathy and therapist, basically we say the psychosurgeons, we are psychosurgeons. We work with mind, we operate the mind and see things clearly, and then what needs to be done with the therapy, how that can be better done. And the doctors will do with the brain, the neurochemicals and brain activities and things like that. So when there is a collaboration of these two, definitely there can be better results. And what I see as important here is the psychiatric medicine, the English medicine has got a lot of side effect, and everybody knows about it. Many. So I would say, yes, in the extreme cases of sometimes psychosis and schizophrenia, those kind of areas, sometimes, we need to really, we don't have any other choice. We have to refer them to them. But most of the cases, and especially when it's the onset of the symptoms or it's just starting, if they are helped with homeopathy or the therapies, and most of the people can be helped, and definitely there can be much improvement. But the problem I always see here is, I'll tell you what are the areas that I have seen the improvements are. One is OCD, another one is stress and anxiety disorder, panic disorders, cyclothymia. I have very clear evidences working closely with Dr. Alphonse. Cases have been, really improved considerably well. And then we have some sexual addictions, things like that, sexually deviant behaviors and obsessive sexual, interest and behaviors like that. We had the anchor issues, people who are falling into depression and, borderline, all these areas, we have seen great results working closely associated with homeopathic practitioners, where homeopathic medicines are used, and plus the therapy at the same time went hand in hand. And every time my clients has told me that, they feel that improvement considerably when they compare to their previous state. So as I told before, what we lack is authentic research findings. Sometimes it is like I get, even, that I am a teenage and adult specialist, and even the teenagers today, they're very, very they have all the knowledge because they open the Google, they get everything in their fingertip. And sometimes I need to get into kind of some kind of a very healthy argument with them to convince them go for homeo. They say, I don't believe in homeo. And this is something I want any of the homeopathy to I have no problem. My children goes to Dr. Alphonse. I go there. My husband goes there, and I have so many friends, go there, and they say that, okay, we have results, and I say I have personal result, and I have faced this with many people. Could you show me some research finding? Could you show me some data? Could you show me some case studies which shows that yes, this is effective? You say, okay, that is it, this is it. But when we read, there is nothing. When we read, there is nothing. But when you look at the other English medicine, and even our area, I publish papers, and I write, I say that how the result is happening with whatever therapy, how it is coming. But when we look at it, I just go search. It's not that much, but we have a number of homeopathic practitioners. We have a lot of them, and this has been practicing from since when? And they recently, maybe 2 weeks ago, I had the same kind of a dialogue with a child who's 20. He's not a child, he's a young adult who's around 19. So I want him to take, because he has got a problem. He is an avoidance disorder. So avoidance disorder, I told him that, okay, just take it, because to rest your mind, let's go for some homeopathy. He gave me a half-an-hour lecture why I should not take homeopathy. And he's saying that UK is eliminating it. It started in Germany, homeopathy. I don't know where, Germany? Yeah, they are not having it. They are just removing it from their system. I was just sitting like this, listening to his lecture, and how to, how to prove him wrong. So I started to search in internet. Then I bring some form of information. Then he countered it. It went on for, I think, and there's almost 70% of our session, 1 hour session, went on making this. Finally, I have to surrender because I couldn't find any kind of a paper or research paper or findings to prove that this is something is happening. This is something which I really would like you as professional to give us. So uh, clients trust us. Yes, definitely they go. Other than I said, it's authentic. It has got something. It's data there, and like if something happens like that, it will be really helpful. That's what I basically wanted to highlight today. So anybody wants to ask me any questions, I'm ready.
Dr. Susan, was really lovely hearing you. Yes, as you rightly mentioned that mental awareness has started getting more and more common and everybody started accepting it. Certain celebrities in India like Deepika Padukone and international sports celebrities have accepted. It's not a, we ourselves from the cultural background we come, anybody who goes to see a psychiatrist or a psychologist, we kind of label them as either mad or having certain kind of conditions which are not treatable, and that's why everybody avoids going and seeing a psychologist. It's great that you have so much of faith in homeopathy, and hopefully the homeopaths here and around will not let you down, especially Dr. Alphonse, since you're sending the work there, and he's a great doctor and great lovely human being. What there is enough of data and research work. I mean, we'd like to share it with you whenever possible. Thing is, in when you search Google, you get Wikipedia, and Wikipedia has its own opinion, and then you can't keep changing that, and that is always going to be there. It's not going to be changed, but of course there are better ways of convincing. Was lovely
No,
hearing
there are
you.
research sites. So
There are
that's where the papers.
homeopathic journals which write on research. Dr. Devadiga, Dr. Jerajani, they have been institutional in these kind of research work over years. And in future, if there is something, then they will share the links and data with us.
Please,
Yeah.
that
If there
would
is
be really.
any doctor who'd like to talk to Dr. Ask something to Dr. Susan, please.
I think, Dr. Riyaz, there is something in the chat box. I think Madam Amina, she wanted to put across something. If she wants to speak or just put across the question.
I can't see in the chat. Who is this?
Chat box. It's.
Assalamu alaikum, Dr. Rito. Yes,
Yes.
assalamu alaikum for everyone. No,
Good
that
afternoon,
thank you
madam.
to doctor. She gave very good speech. No, we have this meeting not only for this speech. We know the situation here in UAE. We need some research, some documentation, some not only like now what I am sitting, listening. This is only like talk. We are here to listen for everyone if they have really some research. We want to listen some research to have some really documentation that really homeopathy can work with the mental health for any cases, for any cases. Now what I listen, I am sitting, listening. This is only like a talk. We need to discuss. You are all together here to discuss all the cases that you have really here in UAE. We need to do some documentation that we need to show them, yes, with homeopathy we can help, we can support. No, what I listen now, this is really, I feel very sad.
Yes, doctor.
Thank you.
I really appreciate your input. And I agree with what you're saying. We need more research done. We need more doctors getting involved in, actively participating in this research, having data documented, and then sharing with our colleagues, the allopathic doctors and everybody.
Yes.
It is under process. People like Dr. Devadiga, Dr. Jerajani, Dr. Deepak, they are doing things like it's all under process and it's happening. This same questions have been asked over last hundreds of years.
Yes.
Whether we are authentic, whether homeopathy works, whether we have data. It's all happening. It's under process. Sometimes it takes more time because certain governments don't agree with everything,
Yes.
and that's why it takes more time. Yes, Dr. Susan.
I think yeah, we need to, now India has got this Ayush ministry and everything. It's more helpful. But I would say, things like, especially in the mental health area, American Psychological Association, like that, associations are really having research papers. Maybe homeopathy can try there as well with proven cases, how things work. Actually, that will definitely give you more value. So I think doctors should focus rather than just practicing and giving results. Maybe need to have something like that, so it is more authentic.
Exactly.
I want
exactly.
to say something. We no need to wait for allopathy doctors what they think. This is when we open our institute. We try to convince the others doctor. Now we don't have time to do it. We try to support our patient, and really I will tell you, like, if I will take one discipline, like you see for Chinese medicine, acupuncture. Before we go for all IVF doctors, please try to refer your patient to us before the IVF. Nobody listen to us. Nobody listen to us. This is in Abu Dhabi. No, now I will tell you, we with our patient, the patient convince the doctors. Now the IVF doctor, they start to refer the patient to us before, and really more than 60% the success for the IVF. That's why, please, this is no need to wait. This is association to convince someone or allopathy doctors. No, this is try to do. We are how many doctors homeopath? Really, we have very nice doctors homeopath, very active. They try to do the best. If only in between you can do the research, and you can also to have selection for all documentation for very good cases. This is, we can promote homeopathy. We can convince them. We can convince that homeopathy is safe, and really many they can start using the homeopathy medicine.
I think, yeah, doctor, I mean, what we'll do is also, amongst us have another talk where we can particularly discuss this. In fact, we
Yes.
are, having a group which we actively work on this. So it was lovely. Thank you so much, doctor, for your input. And Dr.
Okay,
Susan, once again,
welcome.
thanks a lot. I'd like to introduce the next speaker for the evening. He's a friend of mine. He has passed homeopathy and since practicing since 1995 in Oman. He is the person who has introduced homeopathy to Oman, the first country that actually accepted homeopathy as proper science. He's done his post-graduation from Irish School of Homeopathy, Dublin. He writes for various newspapers, magazines in Oman, Muscat. Also a celebrity doctor by himself, speaking on Oman radio. He's had many international seminars, got a couple of big awards like Healthcare Excellence Award in 18, and in 2020 he received Pride of Asia, another award. I'd like to introduce Dr. Deepak Sharma. Please, Dr. Deepak, welcome.
Thank you very much, Riyaz.
Dr.
I still
Deepak?
remember the day, yeah.
Dr. Deepak, before you continue, I just want to announce, if anybody wants to type a message in the chat box, please make sure you do it to everyone, because they are typing as direct message to me. So everybody is not able to see the messages. Please make sure that you make it to everyone. Thank you. Please continue, Dr. Deepak.
Yeah, Riyaz, thanks for your kind introduction, friend. I still remember the day we met in Abu Dhabi. We both came to give our exam, and we both got the license for independent clinic.
Yes, we did. You're the only two.
Unfortunately, I could not leave Oman. So, friends, it was nice listening to our previous two speakers, Dr. Susan. If you have time, Madam Amina, if you have time, please attend. There's another seminar I'm presenting after this. Your doubts about proof of homeopathic action will be sorted out if you attend that seminar. Coming to today's topic, Ritu, can I share my screen?
Yes, please, Dr. Deepak, you can share. Hope you're able to do it.
Is it visible?
Yes, yes, absolutely fine. You can go ahead.
So the topic of today was mental health on Mental Health Day. I chose to speak on effects of COVID-19 on our mental health and the homeopathic approach towards it. The uncertainty, fear, changes in daily life caused by COVID-19, they have drastically affected people's mental health, including the doctors. Bereavement, 8.44 million deaths as of 7th October 21. The sudden interpersonal loss associated with COVID-19, along with severe social disruption, can easily overwhelm, in many ways, individuals and families. It is very difficult for them to cope with bereavement. Isolation due to disease, isolation associated with travel, loss of income due to loss of pay, due to loss of jobs, and above all, excessive expenses. If you get COVID positive and hospitalized, it is a throat-cutting experience for people. They beg, borrow, steal to pay for those bills. Then fear, definitely fear not only of getting infected, but fear of passing to your loved ones, ultimately also leading to isolation. So all these factors have triggered mental health conditions, or they have exacerbated the existing ones. Simply being diagnosed with a novel, potentially life-threatening disorder or disease can trigger stress and anxiety in itself. The magnitude of death over a short period of time became an international tragedy on a historic scale. In a study from the post-SARS era of 2003, also it was observed that patients developed long-term fatigue, diffuse myalgia, weakness, depression, and sleep disorders. It also showed higher rates of PTSD, depression, and substance abuse for patients, families, and healthcare workers. Similarly, post-COVID-19, I hope I can say post-COVID-19 because we still have active cases going on. Many people have faced increased level of alcohol and drug abuse, insomnia, and anxiety. Major concern today is the transformation of normal grief and distress into prolonged grief and major depressive disorders and symptoms of PTSD. COVID-19 patients, they frequently experience neurological complications such as confusion, dizziness, delirium, and other cognitive disorders, mainly because of hypoxic brain injuries. A rise in the symptoms of depression and anxiety is to be expected during times of international crisis. What we are seeing today, these elevated symptoms have translated into an increased number of clinically significant cases. We all are getting much more mental health problems in our clinics than ever before. Long-term effects of COVID-19 have become a new focus of attention for clinicians as well as for researchers. We all know that COVID-19 will go, but will the effect of COVID-19 ever go? Not just COVID-19's effect, we are here talking also about the vaccination effect of COVID-19. They are here to stay. We, homeopaths, we have a major role to play in this. And as Dr. Amina has just talked about, Dr. Susan has talked about, it is high time we start collecting data and compiling data to prove that we have a huge role in this. Mental health and homeopathy, if we look into this topic, right from the time Dr. Hahnemann found the nature's laws of healing and gave the principles of her science, he had emphasized on treating man in disease and not just the disease in man. In aphorism 6, he says, the The unprejudiced observer takes note of nothing in every individual disease except the changes in the health of the body and of the mind, which are felt by the patients, which are remarked by those around him, and observed by the physician himself. All these perceptible signs represent the disease in its whole extent. Again, in 210, he says, in all cases of disease, we are called on to cure the state of the patient's disposition to be particularly noted, along with the totality of the symptoms. If we would trace an accurate picture of the disease, I think someone is not mute. Can you please mute yourself? You are disturbing the presentation. If we would trace an accurate picture of the disease, in order to be able to perform and treat homeopathically with success, we have to know the disposition and we have to know the totality. Again, further in 211, he says, this holds good to such an extent that the state of the disposition of the patient often chiefly, he's using the word chiefly, determines the selection of the homeopathic remedy as being a deciding characteristic symptom, which can least of all remain concealed from the accurately observing physician. Now, we should be able to determine the disposition of the patient in our first consultation. And if understood, it makes the selection of the remedy very easy. So what is disposition, my friends? The dictionary meaning of disposition, we all know, a person's inherent qualities of mind and character. It's a genetic trait that individualizes a person, a tendency to act in a specific way, a state of habit or one's usual mood. We can have disposition as mental disposition, physical disposition, or general disposition. Chief complaints with which patients come to our clinic during this post-COVID-19 era: anxiety, fear, insomnia, compulsive hand washing and related irritant contact dermatitis, depression, poor concentration, especially in children. We see hyperactivity. We are seeing a lot of social shyness in children owing to lockdown for such a long time. We are seeing mood disorders, not only in children, in adults also. Now, selection of medicine and homeopathy. Although the repertory gives the choice of medicines for all these conditions in different circumstances, but the remedy is always selected on totality. For example, in complete repertory, the rubric mind, in the section of mind, anxiety with fear, we have 124 remedies. Complete again, mind, anxiety about health, 87 medicines. Thoughts, rush off, flow off with sleeplessness. In combined repertory, in mind section, fear, infection of. This is what we are seeing most of the time in most of the patients. Combined gives 7 medicines, complete gives 12 medicines. The chief medicine being Belhitacarb, Borax, Bovista, Bufo, Calcarea carb in 3+, Curare, Lachesis, and so on. Then we have mind, washing always her hands, having 14 medicines. But when we see COVID, it's not the syphilitic rubric mind desire to wash her hands. It is the symptom associated with fear. Then we have anxiety about future, about disease and of her, which means she's anxious about her disease and anxious about the future. The only medicine here is Kalikar. What we see and how we analyze. In selecting a medicine in homeopathy, we do not see the presenting illness only. We do not see only the anxiety. We do not see only the fear or only the sleeplessness, but we take the whole case to see the disposition of the patient and the totality of his complaint. We look at the main concern of the person. What is the issue of the person as a whole? We evaluate the whole case and select a remedy with the same core as the core running in the person as a whole. I have an example here. This is a case of irritant contact dermatitis. You can see bilateral hand involvement. Observation when this patient entered the consultation. She was a well-dressed, well-built, fair European lady. Apprehension was visible in her as it was her first visit to a homeopath. She was referred by a physician friend of mine. What were her complaints? Itching, dry rashes, bilateral palms for 1 year, for which she had been using conventional medicine and local applications. There had been remissions, there had been relapses, and she was tired of it. Her second physical problem was GERD, but her urea blood test was negative. Now, case taking revealed the following. She was quite anxious with fear of infection, especially with COVID-19. So she was washing her hands and using sanitizer frequently. Now, this is the case with almost every second person on earth today. Now, since childhood, she has been quite an independent person, would never take help from anyone. Now, to a doctor, this means nothing, but to a homeopath, this is so important to know. She loved reading books, especially medical articles and medical books. She was concerned about what others will say about her disease. She was concerned others will see her hand condition. She was afraid that everyone in office notices her hand. Again, to a normal doctor, it means nothing. Anybody with irritant contact dermatitis can be concerned about others. No, not all. There are people who are careless about their complaint. There are people who can cry because of their complaint. There are people who can become angry because of their complaint.
Dr. Deepak, 5 minutes.
Yes,
more.
I'm sorry.
Thank you.
So there are people who can even fight with God because of their complaint. Then her next symptom was aversion to tight clothes around her waist. She loved eating and she desired cold drinks, and she had an aversion to fatty food, averse to overexertion. Asked a lot of questions about her complaints. Now, these are the rubrics which I took for her. Apprehension, fear of disease, independent in general, fear of being observed, government, the desires I have taken, and I have taken light desire for. I would not discuss this because we have limited time. This is a beautiful rubric we see in a clinic every day. Then she had eruptions, hand, palm. Now, when we repertorize the case, putting all these 12 rubrics, we find calcaria is coming in almost all her symptoms except the eruptions of the palm, which are covered by sulfur. So calcaria is covering her totality, not covering her skin. Sulfur is covering her skin also. But in this case, the disposition of this patient of apprehension and social consciousness is different from sulfur. Calcaria shows he is important and is concerned how he looks, which sulfur is not. The wealth of calcaria is self-dependence, whereas of sulfur will be his knowledge. Phosphorus is also coming in this repertorization chart, but if you know the disposition of phosphorus, it's of friendliness. Belladonna is also coming here, but the wealth of belladonna is freedom. So calcaria carb was selected for this patient, and during the second visit after calcaria carb, the patient explained how in the first 2 weeks, there was no change, rather a little more rashes. But she says, I slept quite well, doctor, and the fear and anxiety are much under control. She was able to control her anxiety. That was very important. The quantity of food she was eating and was less now, and she had lost almost 1.5 kg of her weight. Now, this is the patient after 6 weeks. You can see on the left side of your screen, the affected palm, and the right side of the skin, the cleared palm, although calcaria did not cover her skin symptom. This is the left hand of hers. Isn't homeopathy amazing? All what is required is a complete case taking and the right evaluation of symptoms for repertorization and the knowledge of disposition when stuck with similar medicines and repertorization. We must learn to know our remedies just as we know our friends by their aura and by their personality, quote by Dr. C.M. Boger. Every remedy has a theme, a core, and if we use that knowledge to match it with the essence of the case in front of us, any reversible pathology can be corrected with associated improvement in mental health. Homeopathy is both an art and a science. The successful homeopath must be both an artist and a scientist. Science, by definition, is a body of laws and principles. Homeopathy is based on infallible laws of nature. The three cardinal laws of homeopathy, I need not elaborate here. We all know about them. The application of these laws to find the correct remedy and the process of matching the symptoms of the patient to the drug picture makes the scene, makes the science an art too. Fact is that various ailments, both acute and chronic, respond better to homeopathy, which has an upper edge over conventional system in management of many disorders where other systems have no results. Only thing is we have to compile, as Dr. Amina just quoted, and we have to prove it to the world. Thank you very much. Riyaz, I hope I justified your 5 minutes.
Perfect, on time. Thank you so much, Dr. Deepak. And just so that everybody have gone through and understood, lovely case, Doc, great results as always. And Dr. Deepak is very meticulous, given in detail, and exactly has finished on time. Thanks once again. If anybody has any questions, or else we take it to the next speaker. Great. So
I think Dr. Riyaz, there was a message in the chat box which probably Dr. Manjari had written in response to Madam Amina. If she wants to speak it out, or maybe she can just.
No, it's okay. I think we can't take the case. The thing will go out of time.
Okay.
It's Sunday here means we are working, others are not. So we don't want to, keep people from their clinics. The next final speaker for the night, the extinguished guest, I'd like to introduce. He is an MD, done PhD. He's one of the most leading psychiatrists, a veteran since more than 30 years in the same field. He's been practicing and has special interest in chemical dependency. He was a founder member of Kripa Foundation, also was a dean, a director of Kripa Institution. One second. Sorry, the timing always happens that you get a call at the wrong time. He's worked, extensively with the Bill Gates Foundation. A great person, my sir again. And when you look at him, he's a person of tranquility. You look at him and you feel really relaxed. He is none other than the great Dr. Rajiv Jerajani. Sir, lovely to have you. Please take over.
Thank you. Thank you very much. It's a pleasure to be here. And I'm not a homeopath. Let me clarify that to begin with. But by some good people whom I have worked with, I have been able to learn significant amount of information, which is not yet a part of knowledge. But I thank Dr. Sharma, who spoke before me. It's very interesting because what I see in homeopathy, not as an art or science, it's a philosophy. It's a beautiful philosophy. There are a lot of the answers once we get. I always had an argument with Dr. Devadiga, and he always supported me also, that pharmacy and repertorization is a very important component. I agree with you. But people tend to neglect organon. And somehow I become a little uncomfortable about that part of the story. Most of the time when we talk in terms of mental health, you made very interesting observations, the effect of the nature, the environment. Let me, make some statement on that let us all understand there are 4 different types of effects, if you make note of that. That something is called ripple effect. That there is an event and then it expands and, like dropping a stone in the water and the ripples come on. There is something called butterfly effect, where it starts very gently and it enhances very hard. There is also what we know as snowball effect, where it starts a very small stone, which turns, say, avalanche, a snowball, and it becomes a huge catastrophe by the time it reaches the downstings. Or we call it a domino effect, where if one event takes place, it may cause number of connected events which results into, which is not even a part of that event, and it results into domino effects. Now, in mind, 90% of the medical doctors, I might sound a little cynical and please don't repatriate me, the people are paying more attention to pharmacy. People are paying, even in allopathy, in modern medicine, I have seen indiscriminate use of medicines which are not even indicated. I agree with Dr. Suzanne. She said there are a lot of side effects. Yes, there are. But the question is that there are not many people who bothered about that part because their focus, their philosophy is a little different. The question is, again, I thank Dr. Sharma to talk about dispositions. Well, I would say, I would call that when we are looking at the patient, we look at the predispositions. Whether it is genetics, familiar, inherited, whatever, as you rightly mentioned. But these are the predispositions which can trigger, which needs a trigger, which we call precipitating factors. There are, by and large, we have to be aware of that there are not. Look, I always say that maybe there is 2% of people who are suffering with illness. All over globally, the incidence of and prevalence of mental illness is not more than 1.5%. So the question is, unfortunately, if you go by the text which are given by the West concepts, like ICD-9 or ICD-10 or DSM-5 or 4, trust me, you can label everybody. Everyone. You can, whether it is part of the behavior, emotional responses, thought process, there are enough number of higher functions that we have. Putting a label, it is very easy. And this is where I talk to most of my patients as well, that look, I'm not going into theory of psychology, causation, etiology, no. But the basic understanding it is required. That how many of us have experienced fear? How many of us have experienced sadness? How many of us are anxious? I appreciate what you said, that there are personalities, what Dr. Suzanne said. It's a continuum. There is how would you go from a normalcy? The only problem with the Western information which is coming, nobody has defined normalcy. There is no definition. The definition of illnesses have been given very clearly. But how many times in modern medicines that you see definition of cure? In fact, we had a wonderful discussion with Dr. Devadiga earlier in my time, where the most important concept was gentle restoration of premorbid status. And that is very important. Now, when I say that this person is well, look, just because I had a bout of anxiety and pandemic was everywhere. Infection rate extremely high. Agreed. It is a historical event which we witness. But then how do we say what is pathological and what is the physiological response? And that is where we understand that if the intensity with which the patient presents of that symptom, in fact, human beings are a cluster of different symptoms. Sometimes, when I had long discussions with Dr. Devadiga, and he told me, you are a prover. And I said, yeah, but then I have these issues. And I can tell you that this aggravation has taken place. He doesn't tell me the name of the medication. It is only by my symptoms that we discuss. And he has helped me hell of a lot in understanding homeopathy. So when we say, or when when do you label that this patient is mentally ill? And I might sound a little critical about it, but who knows where mind is? It's an abstract question. Most of the time, it is the totality picture, whether we call it vital force or cosmic force, cosmic energies. It is important for us to understand that conceptual framework. I very much appreciate Dr. Sharma when he talked about totality, that it is not in isolation. The stress, as you rightly said, is physical, mental, social, spiritual, financial, occupational, sexual, family relationship. Primarily, everything is related to relationship. It is your relationship with yourself, it is your relationship with others, or it is your relationship with whatever you believe, trust, have faith in. I'm not a religious person, but there are a lot of reasons why people develop these kind of problems, which are emotional problems. But then it is intensity which needs to be standardized, which does not happen. It is the frequency which needs to be standardized. It is when intensity is either too high or too low, we call it is out of the range of that function. Whether it is hypertension or hypotension, whether it is increased in sugar or reduced, whether it is hyperthyroid or hypothyroid. We need to understand the intensity. Other important criteria is the duration. Then I feel afraid, but is that fear only to one concept, one part of fear? I think that fear is supposed to be a string of factors which would result into. In your clinic, there is a snake. What are you afraid of? Snake or snake bite or snake bite poison or snake bite death? The question is, it is how you have been able to elicit history of that patient. Unfortunately, with modern eminent technological phenomena, people are looking only at the biochemistry. They are not looking at the clinical or human aspect. The point is that if we understand the intensity, duration, and frequency, that the same person is getting time and again similar kind of response to similar kind of stimuli, then there is an issue which we need to look at. Now the question which Dr. Amina raised is that I still look at what can we do, what Prabhakar mentioned to begin with. That let us focus on world mental health, and into bracket I always say prevention. And how would that happen is by ruling out organic components. There is a distinct difference between definition of the ailments which present the same symptoms because of malfunctioning of the brain. But that malfunction can be because of the structural changes or functional changes. When we have not been able to elicit any other cause, that is the time we look at it as a functional ailment. But The early diagnosis is very much required. It is not that I don't do MRI of my brain, or I don't advise that to my clients. If there is a psychiatry, how many times do we refer the patient to the psychiatric patient for MRI? Because we take advice of a neurologist. I have seen homeopathy friends, lot of friends in last so many years I have been associating. And I tell them, please look at this component. It is possible. You are getting wonderful symptoms. And I was so happy to know that mind is the largest topic in homeopathy textbooks. But do we read? There are more than 3,000 remedies. But thank God we have artificial intelligence, which will help you to repertorize in a few minutes. But that clinical relationship with the client to elicit the symptom, which is not even going to give that symptom in your initial interactions. So it is very important that early diagnosis after ruling out organic disorders. And all of you, I'm sure, are aware of what the organic disorders which we are talking about. Another issue is access. The pharma industry, sorry, I'm again sounding critical, that in allopathy, all researches are sponsored by a pharma industry. And sorry, I don't trust or have faith in that. It was good question which was asked that, in earlier symptoms, Prabhakar mentioned that Google doctors, even on NetMeds and British medical journals or web med issues, sometimes you feel that, no, this is not like this. And that can happen only when you independently feel. Look, I believe, as Prabhakar said very correctly, that it's a great deal of observation which is required for a homeopath. From the moment the patient is walking in your clinic, yes, you need to understand that your mind starts working on it. And I was lucky to work with him. Another area which I worked with was forensic medicine. And forensic medicine also is extremely observant phenomena which we need to practice. And then came psychology. I came in psychiatry a little late, but then I became disillusioned with the current medical practices, even in allopathy. And all the more reason for me to be drawn towards the homeopathy. My PhD is in alternative medicines. Because unfortunately, there are experts who can treat heart, who can treat kidneys, who can treat diseases. But how many of them can treat people? That is the problem. The mind is all pervasive, vital force everywhere. Memory is in RNAs. Do we bring about change? Yes. Can constitution can change by giving constitutional remedies? I don't know. And if yes, to what extent? That is the question, because today the research is going into aging, and that's another area of research which we should start working on. Most of my friends, Riyaz is saying, looking at me, and sir, you look like same what you were looking 30 years ago. Hello, I'm not using any of the anti-aging products, but that is what it is. That one has to work on that part, make clinical observation, make documentation, monitor the patient, get the data, compare the data, review the data, and then publish it. Research is not a small game. It's a very big game. The question is that it starts with data capture. And 90% of the general practitioners don't keep data. They make some notes on some piece of paper, And in, younger people, they have computers, programs which are available to get all kinds of information. They don't analyze data. That is the problem. So all of you are senior people. I would rather suggest that when you are teaching your children, please make it a habit to tell them, start with data collection, start working on them, get help of a statistician, biostatistic people, get the research done, discuss with people, take help of seniors who are giving you experience, because I still believe in mind. It is not only biochemical or circadian rhythms. If you go into the psychological schools, let me tell you, there is another school of thought which says anti-psychiatry school, which says, I will quote Thomas Saz, schizophrenia is not a breakdown, but a breakthrough from the shackles of society and sick family. Very interesting and amazing statement which he has made. And I can share one of my personal experiences, which I think Dr. Devadiga was surely witness to, that I was teaching in the same institution for 20 years with him. And in front of us came Cooper Hospital, and there was one gentleman who was sitting in that corner who doesn't wear any clothes. He has got long hair, no hygiene, nothing like that. And I told my students that you make a group and go and say hello to this gentleman. And they would all be surprised that, no, sir, wo to beggar hai usko. People are throwing stones at him and dogs are barking. He's mad. So I said, no, try it. You want to learn psychiatry, you should experiment. So you go there. You won't believe that ultimately there was one small group which I accompanied them. That fellow was a chemical engineer. He spoke fluent English, but he went through severe trauma and he renounced his good job, his family, his assets, his valuables, and he decided to let go of everything. He came on streets. Now, do I call this person enlightened or schizophrenic? That's $1 million question. The same person, if he's guided little bit, he's supported with little bit of medications, if required. In fact, the current circumstances, the anatta.in, it's what we teach to we don't treat the patient, we teach the patient. And what you teach is an alternative way of life. The life that you can experience in absence of addictive substance. And trust me, I prefer homeopathy over allopathy medications. It has worked wonders. I don't remember the name of that brown sugar which we did titurations and prepared a remedy, because based on principle similia sibilis. It was very interesting and there were good results, but no standardizations. Of course, it is done in the pharmacy lab, and therefore we could not go into a higher potency, but lower potency, it worked wonders. So I'm very grateful to all of you to let me share my views to on this good day. And I must thank Riyaz and all senior homeopaths there. Dr. Sasan, when you mentioned, yes, I have heard his name. And Dr. Sharma, I must say, recently there was a book published about Oman history. If you look up in Muscat, if you are Jerajani name, look up in that book. The temple there is Jerajani temple. So
Are
I
you
have,
related to Dr. Hivel?
she's my niece, my brother's
Oh.
child.
She's my best friend.
Ah, okay. That is
She and
my
Sachin.
brother's daughter.
Okay. Okay. Small world.
Small world, yes. So I have been lucky. I've been grateful to all of you, and thank you very much.
Thank you, sir. Thank you.
Thank you.
Thank you.
Thanks a lot, sir. Was really lovely as always. I mean, again, I have heard him after a long time. It gets into a spell, and you keep thinking, and the more you keep thinking, the more you get lost. As always, words of wisdom. Thank you, sir, once again, and thank you all the speakers, sir, Dr. Devadiga, Dr. Deepak, Dr. Susan, and again, Dr. Jerajani. Lovely having you all. And I'll pass the mic again to Dr. Santosh. Dr. Santosh.
Dr. Ritu, no?
Dr. Ritu. Okay, then Dr. Ritu.
Yeah.
Mike,
okay.
Mike.
This,
Mike. Unmute.
Unmute yourself, Dr. Ritu. Yeah. Okay. So now the time is for vote of thanks, isn't it? Almost the time has passed 6:40. 6:40 means in UAE, it's all of us, you have to go for the work. So I'm not extending. First of all, I would like to extend our thanks in the name of HME. I would like to thank Dr. Devadiga, who has given a wonderful explanation. And regarding the reference work which we have to do, what can we do in Middle East? Everything he has explained very nicely. Thank you, sir. Second, I would like to thank Dr. Susan. She is also from Kerala, who give a very valuable lecture. Actually, all of us need a help of psychologist. I am keeping a psychologist in my clinic personally. After that psychologist comes to my clinic, the cure rate went tremendously up. So the psychologist help is extremely important to make the mental health happy. Thank you, Dr. Susan, for your wonderful explanation. And my friend, Dr. Deepak, as usual, he rocks well. Nothing more to say. Thank you, Dr. Deepak, and we will be there throughout your lecture after a few hours. Dr. Jerajani, this is the first time I am hearing your lecture, sir.
Thank
It
you.
was a wonderful one, and that makes all of us excited. Thank you. We will call you once again. And next, I am thankful to Dr. Riyaz Badami. Also, he is our core member team for moderating this session in a very beautiful manner. Dr. Sasan, I hope during this early morning time, he was along with us. Always he is along with us. And as said by Dr. Riyaz, without him, we won't practice there in UAE. Big thanks to Dr. Sasan. Dr. Kamil, since he took charge from Lotus Medical Center, almost all the webinars he has been attending throughout the session. We are very much thankful to you, sir. Then Madam Amina, always our big thanks to Madam. All our works has been taken by Madam Amina, and she is running a wonderful clinic in Abu Dhabi. Then all the doctors who have participated in this webinar. And at the end, our core team members, especially our main force behind us, Dr. Ritu Manchanda. Without her, we could not able to do all this work. Big thanks to Dr. Ritu. Thank you, all of you, for your presence in this seminar. Thank you very much. Over to Dr. Ritu.
Thank you. Thank you, Dr. Santosh. I think you appreciated way more than required. Me,
Oh,
I'm talking about me.
No.
Everybody else were too good, and all the speakers, as always, I mean, excellent speakers and overwhelming. since you've already given the vote of thanks, I will just conclude with a few important announcements that would be there. One is our next webinar, which is a regular webinar series that we have every month, third Wednesday of every month. That will be 20th October, Wednesday, 2 to 4 p.m. That's a standard time we keep for all our webinars every month. So next would be on dermatology. All those who wish to attend, they are most welcome to be part of it. So you can mark the date as 20th October, 2 to 4 p.m. Wednesday. And coming to the videos, I think there has been an overwhelming response by our own doctors who created videos on World Mental Health Day. I think they were beautiful videos created by all of them. I have compiled all of them and I'll be releasing them one by one on our YouTube channel, which is Homeopathy Middle East. So you can like the videos and subscribe to our channel, which will give us more promotion and awareness amongst even the common public whom we wish to promote amongst. So, and last but not the least, I would like to call upon Dr. Shahina if she is there. Dr. Shahina, are you there?
Yes, doctor, I am very much there. I'm here.
Okay.
I've been attending the entire.
Yeah, okay. So I would like to wish Dr. Shahina a very happy birthday from our team of Middle East. I think it's been a pleasure that you are there here and we are all here to celebrate your birthday. So can we all sing for you?
Oh, thank you so much, doctor.
I think we can all unmute ourselves and just wish her happy birthday.
Happy birthday, Doc. Happy birthday. Have a lovely
birthday.
Wish you a very happy birthday, Dr.
Wish you
Shahina.
many, many happy returns of the day, doctor.
Happy
So we
birthday,
have
Dr. Shaina.
lot of blessings and wishes from all of us to you.
Thank you so much. That's really very
Happy
nice.
birthday.
Okay,
In fact, the birthday is also coming on the right day for a psychologist, for a consultant homeopath who has been blending psychiatry and homeopathy together and practicing successfully. So I think the day was meant for me.
Oh, wow.
Very
That's
good.
great. And I must mention, there's a amazing video created by Dr. Shahina, which I'll be posting in the group Homeopathy Middle East. You all must watch it. It's really amazing. So I think with that, we will wind up our session for today. And I thank you, all of you, for joining us today and see you again in the next
Thank
one.
you.
Thank
Thank
you.
you.
Bye-bye.
Thank you,
Dr.
everybody. once
Deepak,
again.
we will be there.
Thank you.
Okay.
Thank you, Dr. Santosh. See you all.
Okay.
Whoever can attend.
All the best.
All right. Okay.
Thank you.